Let's call it the $6,400 question. At the Democratic Convention, you're probably going to hear a lot this week about the fact that the Medicare plan advocated by Paul Ryan will supposedly cost retirees $6,400 above and beyond any costs covered by the government for their health care.
They get a voucher. And because the voucher would not keep up with rising health costs, seniors would be forced to pay, based on studies, an extra $6,400 a year.
But there's some problems with that figure. First of all, it's only an estimate. Second of all, it's for the year 2022. But a bigger problem is that this dollar figure is an estimate for an earlier version of Ryan's plan. He's since changed it significantly to address some of the loudest complaints. The new version of the plan, for instance, includes the option for traditional Medicare for everyone, as well as a commitment that at least one healthcare option would be fully covered by the government. Indeed, the new plan is much more generous than the original version. The old plan had capped growth at the rate of inflation. Now, many experts believe that was too low and pushed more costs on the beneficiaries. In the updated plan, Medicare spending would be allowed to grow slightly faster than the nation's economy. In fact, at the exact same growth rate as President Obama's budget for Medicare. Now, beneficiaries might still face higher costs depending on how well the system worked. But you should be wary when politicians cite specific numbers about proposed plans far off in the future.
The independent report found that out-of-pocket health care costs for the typical 65-year-old would have doubled. That's $6,400 a year more.
This $6,400 number is something you cannot take to the bank. That's two Pinocchios for the Democrats.